Hello, I'm student Dr. Rivera. What brings you to the office today?
Hi, I'm having pain here in my right foot, my big toe.
Alright, I'm going to go through a brief history with you. When did this pain start?
This morning, today.
Okay, and then where exactly would you describe this pain to be?
Right here, my big toe, my right foot.
Okay, perfect. Now, has the pain been consistent or inconsistent since you started feeling it?
It's been pretty consistent.
Alright, and how would you describe the pain? As sharp or dull?
Sharp.
Okay, and then do you do anything to make the pain, does anything make the pain worse?
When you like put pressure on it.
Okay, have you done anything to alleviate the pain?
Taking Tylenol, but it doesn't really do much.
Alright, and then this pain that you're feeling, do you describe it as radiating, like electric?
No.
And then the timing of this pain, have you ever felt this pain before?
No, first time.
Okay, and then the severity of pain. From a scale of 1 to 10, 1 being barely noticeable and then 10 being the worst pain you've ever felt, what would you describe this pain?
An 8.
Alright, I'm gonna go through a past medical history with you. Have you had any hospitalizations in your life?
No.
Are you aware of any major childhood illnesses?
No.
Have you had any adult major illnesses?
No.
Are you caught up on immunizations that you're aware of?
Yeah.
Are you taking any medications?
I take Myrtle for cramps and then Tylenol for headaches as needed.
Okay, period cramps.
Period cramps.
Okay. Are you allergic to anything?
No.
Have you ever had any blood transfusions?
No.
And then have you ever been clinically diagnosed with emotional illness?
No.
Mental illness?
No.
And then have you traveled outside the United States within the last 5 years?
No.
Alright, so I'm gonna go through a brief family history with you. Is there any chronic illness, major chronic illnesses on your mother's side of immediate family members?
No.
And how about your father's side?
No.
And then are all your family members alive and well? Immediate family members, like aunts, uncles, grandparents?
Yes.
Okay. So now I'm gonna go through a brief social history with you. How would you describe your sleep on a day-to-day basis?
Pretty normal, like 7 to 8 hours of sleep.
Okay, and then how would you describe your sexual life?
Pretty regular.
Okay, and then do you smoke of any kind?
No.
Do you have any pets at home?
I have 3 dogs.
Okay, and then how would you describe your work-life balance or school-life balance?
Pretty regular, pretty balanced.
Okay, and then how would you describe your day-to-day diet?
It's pretty normal. The only thing is I drink a lot of Coke instead of water, and it's like 4 to 6 cans a day.
4 to 6 cans a day.
Yeah.
Okay, how would you describe your physical activity on a daily basis?
I don't really work out or anything. It's pretty light.
Okay,
So.
and then, so how would you describe your marital status?
Single.
Single, and then have you traveled outside the country within the last 3 years?
No.
Okay. Oh, and then have you had any past surgeries?
I've had a surgery in my foot, but I don't really remember what it was for.
Okay, sounds good. So history is complete, so I'm going to go through a lower extremity physical exam. First, I'm going to start off with your dermatological exam.
Okay.
Would you mind doing your feature? Okay. No observation of ulcerations, open wounds, psoriatic skin, or hyperpigmented skin. This stays true on the posterior and plantar aspects bilaterally. Toenail observation within normal limits on the left foot, within normal limits on the right foot. Interdigital spaces, within normal limits on the left foot, within normal limits on the right foot. And then I'm gonna go through a vascular exam of your extremity. Palpable dorsalis pedis pulse bilaterally. Palpable posterior tibialis pulse bilaterally. Popliteal pulse palpable bilaterally, graded 2 to 4 for all 3 pulses bilaterally. Temperature normal, warm, proximal to distal, but moderate to severe temperature change
That hurts.
in the first metatarsophalangeal joint of the right foot. And then hair growth is within normal limits, proximal to distal. So now I'm going to go, that's complete vascular exam. Now I'm going to go through a musculoskeletal exam. So left foot, dorsiflexion, plantar flexion, inversion, eversion, all within normal limits of the left foot. First metatarsophalangeal joint, within normal limits, dorsal and plantar of the left foot. Plantar flexion, dorsiflexion, plantar flexion, inversion, eversion within normal limits of the left foot. Limited range of motion of the first metatarsophalangeal joint.
That hurts.
with pain on palpation and crepitus also observed and heard. And now I'm going to have you go against, resist against my hands. 5, 5, 5, 5, 5 out of 5, 5 out of 5. So 5 out of 5 bilaterally with dorsiflexion, plantar flexion, inversion, and eversion. Musculoskeletal exam complete. So now I'm going to do a neurological exam. So if I can have you lay back for me, please. All right. Now I'm going to use a semis monofilament on your feet. I'm going to poke you like this, and you just verbalize when you feel a poke.
Okay. Yes. 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 Yes.
Monofilament test normal on the left foot, 10 out of 10. I'm going to do now the same thing on your right foot.
Okay.
Please verbalize when you feel a poke.
Okay. Yes. 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 Yes.
All right, 10 out of 10 on the right foot. Next, I'm going to do a sharp dull test. This is the sharp object. I'm going to put it on the front side of your leg. This is the sharp. Did you feel that?
Yes.
And this is the dull. You feel that?
Yes.
All right, so you tell me if it's sharp or dull on your left leg.
Okay. Sharp. Dull. Sharp.
Sharp dull test normal on the left leg. Now I'm going to do the same thing on your right leg. This is sharp.
Sharp.
And then this is dull.
Yeah.
Okay, so let me know if it's sharp or dull.
Sharp. Dull. Sharp.
Within sharp dull test within normal limits on the right leg. Now I'm going to use a vibration tuning fork. I'm going to hit it, it's going to be vibrating. You're going to feel the vibration, then you let me know when the vibration stops.
Okay.
First I'm going to do your left leg.
Done.
Normal on the left leg. Now I'm going to do your right leg. Please let me know when you feel the vibration stop.
Stop.
Within normal limits on the right leg. Next I'm going to do a Babinski reflex test on the plantar side of your foot. Negative test. Negative test on bilaterally for Babinski. Next I'm going to do proprioception. So please let me know if I move the toe towards you or away from you.
Okay. Towards. Away.
Within normal limits on the left foot.
Towards. Away.
Within normal limits on the right foot. Okay, now I'm going to have you sit up for me. Now I'm going to do a tendon reflex test. So just keep your legs free, no tension. Patellar tendon within normal limits on the left leg. Now place plantar flex for me. Within normal limits on the left leg. Now I'm going to do your patella on the right leg. Please leave your leg free. Normal limits on the right side. Now please plantar, dorsiflex. Within normal limits on the right leg, right foot. All right, your physical exam is complete. Now I'm going to observe the area of your concern one final time.
Yeah, that hurts.
Feel the pain on this area.
Yeah.
Okay. So I'm going to go through your differential diagnosis and your plan going forward. So differential diagnosis, I'm going to go with acute gout as your primary diagnosis with differential diagnosis of bursitis and acute scoliosis of your first metatarsal phalangeal joint in your right foot. So the plan, you were seen by student Dr. Rivera, and I'm going to prescribe 2 drugs for you. I'm going to prescribe Indocin for your extreme pain on your right metatarsal phalangeal joint, and then probenecid to reduce your uric acid levels for your primary diagnosis of acute gout. Now, I'm going to give you this for about a week. You'll return to clinic in a week. But then I'm also going to send you for labs. I'm going to send you for a foot series of your right foot series, so there'll be 3 films. And I'm also going to send you for a uric acid blood panel test to confirm the uric acid in your blood. And then dietary recommendations. I'm going to recommend to reduce your sugar intake. And then I'm also going to recommend when you do Coke, I'm going to recommend Diet Coke or Coke Zero, as this will reduce your sugar intake. And then one last thing is your probenecin is a uric acid reducer for your kidneys. However, this is going to increase your risk for kidney stones. So I'm going to recommend drinking plenty of water or more than usual to offset this side effect. And that'll be it. You'll return to clinic in about a week, and we'll see where your status is then. Do you have any final questions for me? All right, thank you.